Hello, and welcome to another episode of MCREG International on the Go. I'm pleased to be joined by Dr. Gregory Furman. Greg, I would like you to discuss, if you would, Dabigatran. And the use of Dabigatran as an anticoagulant is certainly present, and it's something that emergency physicians need to know about.
Thanks, Brian. So with respect to Dabigatran, which is more widely known as Pradaxa, is a direct thrombin inhibitor or factor II inhibitor, which makes it a bit unique among the NOAC class of agents. And because of that, it has a unique reversal agent. But bear in mind, treatment of a Dabigatran-associated hemorrhage starts with standard practice of resuscitation. So IV fluids, packed cells as necessary, and adherence to what we would normally do in a patient that has an acute hemorrhage. However, if there is a recent administration of a factor II inhibitor, which is Dabigatran, you also have available an agent called idarucizumab. That's a mouthful, but it's called Praxibine, and it has recently been studied as an available agent to actually bind up Dabigatran and take it out of the system such that there's no more active anticoagulation on board. Another unique feature of Dabigatran is that it's the only DOAC that can be dialyzed. So if there is a major hemorrhage situation and active Dabigatran on board and you do not have the availability of the reversal agent, dialysis is an option. Importantly, vitamin K, FFP, and PCCs have no real role in the management of Dabigatran-associated bleeding. In terms of how you measure whether or not somebody's actually anticoagulated with Dabigatran, there's no really Dabigatran level to measure. You can do an Acarin clotting time, otherwise known as an ECT, or more widely available as an active partial thromboplastin time, or an APTT, which most labs that and U.S. hospitals will have available to them. And then finally, idarucizumab, which is an FAB fragment, which is an antibody that adheres to idarucizumab, is FDA-approved therapy, 5 milligrams IV. One-time dose will basically take down the level of idarucizumab in the system to a very negligible level. Here it depicts the molecule. It's an FAB fragment, as I just talked about. Dabigatran has a 350 times more affinity for Dabigatran than Dabigatran does for thrombin. And so that's why it acts so quickly and so effectively. And in terms of the levels that you see in the serum after idarucizumab administration is depicted here, which is the reverse AD trial in the New England Journal in 2017, which basically shows you that once given idarucizumab in a patient that is therapeutically anticoagulated with Dabigatran, the levels of activity of Dabigatran almost go to zero within the first minutes of therapy, in a very effective way to take Dabigatran out of the system. So it represents a strategic advantage in the treatment of a hemorrhaging patient who happens to be on Pradaxa.
Greg, thank you very much. That's very important information, and in particular gives very specific information as to how to reverse Dabigatran. Thank you very much for watching MCREG International on the Go.